In this video, which is part 4 of the Myasthenia Gravis series, I will talk about the complications and diagnosis of Myasthenia Gravis. So in the last video, I mentioned that we can divide Myasthenia Gravis into 5 classes. And the last one is the most severe case, where we'll see the patients having myasthenia crisis. But because myasthenia crisis is very similar to cholinergic crisis when it comes to the symptoms, well, it's important to not only understand what myasthenia crisis is, but also to understand what cholinergic crisis is, so we can distinguish between these two crises, because if we mix these two crises up, well, it can be very life-threatening for the patient. So, in both cases, the patient will experience extreme weakness and respiratory failure. But the causes of these two are very different. So, let's start with myasthenia crisis. In myasthenia crisis, the cause of the extreme muscle weakness and respiratory failure is because of too low acetylcholine neurotransmitters, so too low stimulation in the neuromuscular junction. And on the other hand, in cholinergic crisis, the cause is due to too much of acetylcholine neurotransmitters. So when there's too much neurotransmitter in the neuromuscular junction, well, the receptors will get overstimulated and overdrived, so they decide to stop working. And that's why we also see extreme muscle weakness and respiratory failure in cholinergic crisis, and specifically because we see respiratory failure in myasthenia crisis and cholinergic crisis, well, because the respiratory muscles are getting involved. So the muscles, like for example our diaphragm and intercostal muscles, our rib cage muscles and abdominal muscles, they become weak. And so that's why we see respiratory failure in both of these cases as well. So how would we know if we receive a patient? Well, how would you know if the patient has myasthenia crisis or cholinergic crisis if the symptoms are very similar? Well, the answer is Tensilon's test, also called hydrophonium test. And what hydrophonium does is that it goes to the neuromuscular junction and it blocks an enzyme that is called acetylcholinesterase enzyme. Let me draw it for you. And so acetylcholinesterase enzyme, well, the function of that enzyme is to break down acetylcholine. So imagine when we give the patient hydrophonium and we block this enzyme, well, what happens then is that the acetylcholine concentration will increase because we stop this enzyme by breaking these acetylcholine neurotransmitters down. So imagine if we give the patient hydrophonium and let's say the patient has myasthenia crisis, well, then we will see improvement in this patient after a few minutes, because we go and block this enzyme and then we increase the level of acetylcholine. Well, that will help in increasing the acetylcholine concentration. So in that way, we'll improve the patient's condition, because as I said, the cause of myasthenia crisis is because they have too low acetylcholine. But in the other hand, in patients with cholinergic crisis, after we give hydrophonium to these patients, well, we will actually increase the level of acetylcholine in this patient, which is not needed because they already have too much acetylcholine neurotransmitters. So we will actually worsen the patient's condition. And so it's very, very, very important to always have an antidote such as atropine prepared before performing this test, so we can be prepared in case the patient is in cholinergic crisis. But it's not always easy to see if the patient is improving or getting worse after receiving itrifonium. So there is a good way to measure this by, for example, we can tell the patient to read from a book. So while patient is reading, then we can see if their reading is getting faster or becoming more clear, and so we can see the improvement through that. And also we can check their eyes, because as I mentioned in the previous video, one of the characteristics of myasthenia gravis patients is that their eyes are closed because the muscles of the upper eyelid has become weak, so their eyes are more closed. So when the patient is improving, will we see the eyes are opening. But let's say in case of the cholinergic crisis, well, then we can see that the patient's eyes are not improving, and we can hear that the patient is not improving in their reading, so they're even becoming worse and slower in their reading. So that's a way we can distinguish whether the patient has myasthenia crisis or cholinergic crisis after receiving itrifonium test. But now the question is why these patients in the first place are reaching this very severe stage. Well, in myasthenia crisis, the reason for that can be that they are not receiving enough medication. So they're not receiving enough acetylcholinesterase enzyme inhibitor. So that can be one of the reasons. So we can increase their dosage and by that avoid further worsening of their symptoms. It can also be due to certain conditions, as I mentioned in the previous video, like certain conditions like stress and infections can actually make the symptoms worse because the body has to work harder, and so the patient can reach this severe stage. So we can also perform plasmapheresis or intravenous immunoglobulin IgIV, which I will talk about in the next video where I talk about the treatment. And on the other side, why these patients are getting cholinergic crisis? Well, it can be because they're receiving too much of medication. So these patients are receiving too much of inhibitors of acetylcholinesterase. So too many of these enzymes are getting inhibited, so there's too high level of acetylcholine neurotransmitters. So that can be one of the reasons for that. So what we can do is, first of all, to stop these medications and start them on antidotes, such as anticholinergic drugs. So this was the difference between myasthenia crisis and cholinergic crisis. So how can we diagnose patients with myasthenia gravis? Well, first of all, it's very important to do history taking. So ask the patient into the weakness they are experiencing. As I mentioned in the previous video, I said that there are specific features of the weakness in patients with myasthenia gravis, such as the weakness is worse at the evening compared to the morning. And as well as with sustained effort, well, the weakness becomes worse. So we can see if the patient is experiencing such as these features of this weakness characteristically seen in myasthenia gravis. Also, we should do physical examination and clinical investigations such as serological tests, where we will check the antibodies, for example, the acetylcholine receptor antibodies or muscle-specific kinase antibodies, those antibodies that are causing problems in the neuromuscular junction. And also we can do electrophysiological tests where we stimulate the nerve and see the response of the muscle. Well, in myasthenia gravis, we will see reduced stimulation and reduced response, and that we call for decrementing response. And another good way to distinguish between Lambert-Eaton disease and myasthenia gravis is that in Lambert-Eaton disease, which is also an autoimmune disease, which is also causing problems in the neuromuscular junction, is that when you stimulate the nerve, the response of the muscle will be higher, so it will increase. So that's another good way to distinguish. And also we can do CT or MRI, well, to check the thymus if the patient is having thymoma or any hyperplasia that are triggering these antibodies and causing problems in the neuromuscular junction. And also, as I just mentioned, we can do the Tensilon test or hydrophonium test to distinguish between the myasthenia crisis or cholinergic crisis. So this was everything about the complications and diagnosis of myasthenia gravis. If you want to know about the treatment, well, then continue watching the next video.